Good evening, everyone. Thank you for joining 40 Years of Clinical Pearls from a Visionary Pharmacist with Harlan Lahti. Harlan Lahti is the owner of Finlandia Pharmacy and Natural Health and is widely recognized as the nation's expert in natural health medicine. He and his highly qualified team have been integrating allopathic and natural medicine for over 40 years, and Finlandia Pharmacy has grown into one of the most widely respected and trusted integrated pharmacy and natural health centers in the country. Before starting Finlandia, Harlan worked as a licensed pharmacist in hospitals and the geriatric care setting, where he saw how some prescription medication could have undesirable consequences. If people want to take natural medicine along with their prescription medications, we counsel them, whether it's advisable or not advisable. Harlan says this is one of Finlandia's specialties, and this is also one of Harlan's specialties, to be able to keep people safe. Tonight, he's going to be sharing these clinical pearls and what we can be doing to keep people safe when they're on prescription medication or when they're not, and how to best address healthcare needs. So with all of that said, I'm going to pass the floor over to Harlan. Harlan.
Hi, Heather. Thanks for putting this together for us. This is a topic that's very dear to my heart and something that I've been involved with for nearly 50 years of my being a registered pharmacist. So I started back in Canada early in the retail business, and soon became disillusioned with the retail environment and went into hospital pharmacy, where we were trained on the wards to work with the medical residents and monitor the drug usage with the medical residents on the wards. After 3 years in the general hospital, I switched to form my own business, Finlandia Pharmacy, in the geriatric consulting business. And what happened there is that we were hired to lower drug usage in the geriatric community, and we were paid by the British Columbia government. The more drugs that we were able to eliminate unnecessarily, the more we were paid. So there was great incentive to get people off of unnecessary medications. And this, of course, when you take a person down from 10 or 12 drugs to 2 drugs, something miraculous happens. They get well. And this is a common thing that they do when they bring you in the hospital, is that they give you a drug-free holiday no matter how many prescriptions you're on for 2 or 3 days, and observe very carefully. And of course, usually people pop out of drug stupors. So once in the geriatric community, when we got a person down to 1 or 2 prescriptions, and we started to give them vitamins, and they got a little more activity, of course, they started creating problems for nursing staff because people wouldn't sit in their chair and watch television and required more nursing care. So this often led to unnecessary medications of the elderly. So my involvement in the community, even after I left the geriatric community business, was now what's happening to people? Why are they getting so much better when we take them off prescriptions, which is counter to what the pharmacist usually would think would happen. The more prescriptions you get, the better you're going to get. But this is absolutely the wrong way of thinking. So this has led me into the natural vitamin and health business, 100%, where we had a manufacturing, vitamin and manufacturing company, and now my Finlandia Pharmacy, which is essentially 90% natural medicine, herbs, homeopathics, and 10% prescription drugs, which were all specialty, compounded, hormone prescriptions. And so, as a pharmacist, my orientation is to, if you want to be healthy, let's get you off drugs. And of course, in order to get you off drugs, we have to deal with the problem. And dealing with the problem and substitution of natural remedies and herbal medicines, you know, is an art form. You definitely need to convince the client that they have to change some lifestyle. So this is basically my role now in the community. And I get a lot of patients coming in with polypharmacy problems. And so this is where I spend most of my time with my clients is reducing them off of medications, carefully working with their doctors and watching them improve their health significantly. So this leads me to one subject that I use as a tool and have used for a long time. There's a great deal of misinformation or lack of information probably in the medical world and even in the natural medicine world about how to use this product. And this particular product I'm speaking about, of course, is vitamin C, or some people call ascorbic acid, but vitamin C and ascorbic acid are not synonymous. So we'll go into that. Now, Heather asked me to mention what are some of the clinical pearls that I've seen in my practice here. And one of the big problems that we see with our clients is helping them get back to sleep. And in my estimation, the best sleep aid available is melatonin. However, melatonin must be carefully individualized. And of course, the dosage that's recommended for most melatonin individuals is extremely low. And I take a very aggressive approach to melatonin, generally starting people off with 10 or 20 milligrams. The one thing about melatonin is it's safe at any dosage. So I have some clients taking melatonin in 1 gram dosage. Now this sounds astounding, but there are no bad side effects to melatonin. It's a very short-acting, safe, natural compound that you can use to take people off of psychotropics, tranquilizers, antidepressants. In many cases are very difficult or if not impossible to get people off, but giving melatonin along with this or prior to reducing the dosage makes this job much easier. The next product that we're going to talk about, of course, is the topic of the day, which is vitamin C. If you like reishi mushroom extract, the potential of immune system boosting activity is greatly enhanced when you give it with a good dose of vitamin C, and we'll get into the dosage in a little bit. One of the best anti-constipation products and the quickest action is to use vitamin C, ascorbic acid, the acidic powder, and giving this with baking soda or sodium bicarbonate or potassium bicarbonate. This is given in tablespoon dosages, okay? So this tablespoon dosage is about 15 grams of vitamin C. And you give this equal quantities with sodium bicarbonate. Put this in a glass of water, and of course, it's going to fizz up. And you have the patient drink this immediately. And you can give this kind of dose every 2 hours, and after the first or second dose, I say, don't go too far from the bathroom. Because when it works extremely well, and the benefit of giving vitamin C as opposed to some of the more harsher cathartics that you'll find in the pharmacy is the vitamin C detoxifies the bowel after chronic constipation. So, again, it's very effective, it's very quick acting, and it's very cheap. So, let's carry on with this topic of the day, Heather.
Okay, perfect. So let us know about your personal journey with vitamin C.
My personal journey of vitamin C started a long time before I even got into pharmacy practice. In 1960, I broke my leg in a skiing accident, broke it in 7 places, and the surgeon who did the operation on my leg prescribed 500 milligrams of vitamin C twice a day, and he said, you must take this vitamin C because without it, probably your leg will not completely heal up. In those days, vitamin C was on prescription, and it cost $1 a pill. And the company, it was put out by Eli Lilly, a pharmaceutical company, and In the early 60s, that was the only place you could get vitamin C, was on the pharmacist on prescription. Well, the long and short of it is my leg healed up perfectly, and I think vitamin C helped save my leg. In those days, the injury was at the point that I would have had my leg amputated below the knee. So that was before I even know what it was. And then when I got into pharmacy practice in 1965, I started looking into this. And then I realized that vitamin C was not used that much, and there was not many physicians that knew anything about it or prescribed it very much because of the extremely high cost of one pill. One pill in 1965 was a lot of money, $1 a pill. So to carry on with the ascorbic acid and the vitamin C, let's go on to the topic in more specific detail, Heather.
So overall, vitamin C, or in general, what do you believe is the most overlooked nutrient in healthcare?
Well, the main misunderstanding about vitamin C, in my opinion, now, and these are, if people ask you, well, where's your clinical studies on this? I'm going on my clinical evidence from my years of practice. Vitamin C is not used in sufficient dose to create a therapeutic effect. In other words, the average dose for keeping somebody perfectly healthy, in my estimation, is 3 grams a day in divided doses. So if you give 1 gram with each meal, this will keep a person in basically optimum health, cold-free, flu-free, symptom-free of most conditions. And this is the basic minimum dosage for vitamin C. Now, the diabetic is going to require approximately 2 to 3 times this dose. And so I'm saying 2 to 3 grams, 2 to 3 times a day will prevent all the complications for diabetes. And this is insulin-dependent diabetes, insulin-resistant diabetes. The complications of diabetes are prevented with high dosages of vitamin C.
Okay, so then let's just talk about vitamin C in general, as far as its role within the body and also the benefits.
Well, people don't realize the broad activity that the vitamin C has on the body. It's absolutely essential for all skin, wound healing, and collagen production. So right away, all acute injuries will be benefited by taking even 1 or 2 grams of vitamin C. The healing is speeded up. If there's a severe post-op surgical complication, then, we up the dosage of this. Constipation with bowel health, we'll go into that in more detail, exactly how to do this. It's an antioxidant, anti-stress vitamin. High blood pressure is at a 5-gram dose or better, helped about 10%. Cardiovascular health and strokes, again, these are complications of the blood coagulation system, and vitamin C is a very beneficial product to have floating around in your serum. Osteoporosis, gout, arthritis, eye health, macular degeneration, and cataracts. Now, did you realize that cataracts are caused by a deficiency of vitamin C in the interior portion of the eye? This is very well documented clinically that somehow or other the person is not getting the vitamin C levels in the eye, and of course the lens of the eye gets free radical damage or clouds up. Allergies and asthma. It's absolutely the best thing that you can give for all types of allergy conditions and asthma conditions. Now, when we talk about allergies, there's an inverse relationship between vitamin C, or ascorbic acid, and histamine levels in the body. In other words, if a person is highly allergic, the histamine levels are probably quite high, and the vitamin C levels are probably, serum-wise, quite low. So if you change that by giving the person vitamin C, now, nothing happens below 3 grams. So this is 3 grams per day. It's the starting dose that causes the body to drop histamine levels in the cell. And once the histamine levels are depleted in the cell, the mast cell can break, the histamine can be released, but there isn't much of it. So it's not an antihistamine per se, because it doesn't block the histamine action like antihistamines do, but it just prevents there being available histamine to be released and create the allergic condition. And of course, asthma is partially an allergic condition. It also, for congestive, phlegm breaking down, ascorbic acid, vitamin C is a very good agent to cut phlegm, as along with NAC, or normal acetylcysteine. Mouth, gum, and teeth. If you look at a person's mouth and they've got poor gums and their teeth look like they're in pretty bad shape, probably the person has been chronically deficient in vitamin C for many, many years. This doesn't occur, but this is one of the first places it's most obvious, is the gums.
Okay. So with all these kind of benefits and uses of vitamin C, can you talk about how to actually choose vitamin C? Because there are a lot of different vitamin Cs available on the market, starting with ascorbic acid, and you've got ester Cs, the right C, food nutrient and food-derived Cs, vitamin C just in regular food. So how do you choose vitamin C for therapeutic benefits?
Okay, so as you can see from the chart here, the ascorbic acid, which is pure chemical vitamin C, it has no cofactors. It goes in and out of the body very quickly, usually within 4 hours. More than 60% of the ascorbic acid is in and out of the body. So what we're trying to do is to keep the ascorbic acid levels in the serum, in the plasma, as long as possible. So we can do this with the ester C, and the early studies with the ester C have shown that it gives you higher, longer blood levels of vitamin C over the ascorbic acid. It doesn't go as high, but it stays in the serum longer, and this is what we're trying to do. Now, the right C is a cofactor of sodium ascorbate. Ester C is calcium ascorbate. And they both used to be reacted products. The ester C was originally, it wasn't kind of a fermentation process, but we say it was a reacted product with threonic acid. The right C is the sodium ascorbate that has been reacted with something similar to molasses. So when you get a reacted product, the cofactors keep the level of vitamin C in the serum longer, and this is desirable. So the ascorbic acid used by itself in the doses I'm recommending is quite acidifying, it's quite irritating to the stomach, and it's quite difficult to get a person to continue to take this kind of nasty, very sour tasting powder. The calcium ascorbate is a very bitter substance, the ester C, and it generally is given in capsule form. Given the ester C in powder, very difficult to get patient compliance because they don't like the taste. The right C, sodium ascorbate, which is really the molecule in the body that the ascorbic acid stays, is not that bad of a taste of product. Usually I recommend that you put it with orange juice, grapefruit juice, and it's quite palatable taking in the dosages that I've recommended here, which we're starting at 3 grams a day. Sodium ascorbate doesn't acidify the urine. Now, in some cases, acidifying the urine is actually beneficial because if we have a urinary tract infection, it's useful to acidify the urine, and you do that with straight ascorbic acid powder, and you use between 3 and 6 grams a day. And so this nicely acidifies the urine, and of course you give that with cranberry juice or dried cranberries, or there's some cran powder extract that you can give. This is extremely useful for chronic urinary infections. So ascorbic acid, with its acidity is quite beneficial in certain situations. But generally, the dosages we want, even if you're mixing them in smoothies, it's a bit sour. There's no stomach upset with the right C. There's no stomach upset with regular sodium ascorbate. So this is why we see it's easier for the client to take in the doses that I'm recommending.
Now, you're talking about 3 grams or 3 to 6 grams, and I know further along you're going to be talking about other types of dosing. Can you just do a quick explanation so people understand, if you're recommending 3 grams a day, do they take it all at one time, or do they spread it out throughout the day?
It's actually beneficial that you spread the dosages out. So I say morning, noon, and bedtime. Take your vitamin C dosages, and the right C dosage, then take it with meals or put it in your smoothie. But 3 times a day gives your serum levels or your white cell levels a constant level. So your body's trying to get rid of this product because unless you're eating it in a natural form, there's no cofactors to keep it in the system. So we need to give this every 8 hours.
Okay, so if I understand correctly, that means you want to try to keep, according to how this graph looks, the vitamin C levels in the serum as relatively constant throughout the day, so the white blood cells, and it can have its beneficial effect. So this is the reason why you'd be taking it 3 times a day to keep this level up in the blood.
Right, and so we should go into the mode of action. What happens with the body with vitamin C is when there's an infection, of course the leukocytes, the white cells, they take up vitamin C into the cell as fast. It's like a turbocharge when the leukocytes are out there trying to get a virus, bacteria, fungal. They use the vitamin C in the mechanism of their activity, in the white cell activity. So immediately the white cells are going to be taking the vitamin C out of serum. Now there's an interesting thing that happens when you give vitamin C and aspirin. Now aspirin prevents the white cell uptake of ascorbic acid in normal, healthy people. However, when there's an infection, and particularly respiratory infection, ascorbic acid and aspirin, the uptake of the ascorbic acid is actually enhanced to go into the white cells when the person is under some kind of infection stress. So in Europe, some of the pharmaceutical companies actually have a product where they put the vitamin C and the aspirin together in the same pill because they know basically it's going to be used for a cold or flu, and it helps the uptake of the vitamin C go into the white cells, which is where it does its work in the infection.
Okay. So with that then, let's talk about dosing and how to dose, and not just so much about the 3 grams a day, but when we're talking about bowel tolerance dosing, how do you do that?
Now, when you give a normal individual vitamin C, whether it's sodium ascorbate or ascorbic acid, calcium ascorbate's a little different because it can be a little constipating if you give the higher dose. But when the body is under what we would say infectious stress, the bowel tolerance. In other words, the level of vitamin C that starts to pull water into the bowel, in other words, create diarrhea for a mild cold, is about 50 grams. Now, this is an enormous dose, and Heather and I have just come back from a seminar. You know, we had 3 long days, not very good sleep, and I came home, and last night, after riding my bike, I started sneezing, my nose started running, and I thought, oh my God, you know, I'm coming down with a cold because I'm a little tired. So last night I took 35 grams of vitamin C. I got up twice during the night, taking 2 teaspoons, 10 grams each dose. Went back to bed. This morning I took 10 grams as soon as I got up. And virtually right now I have no sniffles, no sign of cold, so I hit it hard. And of course, I did not reach bowel tolerance at 30 to 35 grams of the right C. So this is a mild cold. Now, severe cold, it's almost impossible to take enough vitamin C or the right C to hit bowel tolerance. Remember, when you have too much vitamin C in the healthy individual, you might hit bowel tolerance at 8 or 9 grams. In other words, it's going to cause a mild loosening of the bowel. Now, this is the only side effect with the vitamin C that people might be annoyed at, that it loosens up the bowel with healthy individuals. But if you've got any kind of respiratory flu, mononucleosis, you can see this bowel tolerance dosage is extremely high. And I don't know how you'd get 150 grams into a person, but with the flu or pneumonia, you know, I have recommended tablespoon doses, which are 15 grams. And I say take 15 grams or a tablespoon of this, you know, every 2 to 3 hours for 12 hours. And you will not get to bowel tolerance with somebody being treated with pneumonia on an antibiotic or with the flu. You just won't ever get there. So you know when you've got enough vitamin C because it's starting to loosen the bowel. So that's a good marker. If a person is healthy, you know, some people were sensitive to vitamin C even at 6 grams. So, but they're perfectly healthy.
Since we're talking about dosage, with children, what is the general optimal daily dose for the children? Okay, so with children, generally there's a ratio. You take the child's weight. So the average adult is 150 pounds. Probably the average child is 50 pounds or less. So there's a ratio between the weight of the child and the weight of the adult. And so, you know, a maximum, say, dosage for a child, 50 pounds, you know, is going to be somewhere in the 1 gram a day dose. In other words, 300 milligrams 3 times a day for a 50-pound child is probably as much as he's going to need. So there's a weight, body area ratio that gives you the proper dose. Okay. Again, you're not going to hurt anybody with this. All you can do is just loosen their bowel if they're perfectly healthy. So how about you can talk about some clinical pearls with taking vitamin C, but specifically the right C. And maybe start with the pathways and how the pathways of vitamin C into the body.
Okay, so the vitamin C is taken into the body with the sodium-potassium pathway. In other words, when you're giving the right C and you're giving some fresh squeezed orange juice, which has a lot of potassium, then remember the right C is sodium ascorbate. So if we give potassium, which is either with an orange or a banana, then it's going to add to the effectiveness because the body's going to take it into the cell through not only the sodium pathway, but the sodium-potassium pathway if you give those together. So what you want to avoid is the orange juice that comes in the grocery store in milk containers, because what you've got in one glass of orange juice is 8 oranges. Well, there's no way that anybody's going to eat 8 oranges, and so I'm recommending squeeze 1 orange, take it with your glass of juice, and then you're not getting too much sugar. You're going to get a huge amount of sugar if you're going to give a big, healthy glass of orange juice that comes out of those plastic milk containers. You're going to get too much sugar and virtually no ascorbic acid. The ascorbic acid in the orange, the average orange picked fresh off the tree, is going to have about 80 milligrams. That's a fresh off the tree orange. But by the time the orange sits and is shipped to you in a truck and it goes to the grocery store, maybe there's going to be 25 milligrams of vitamin C in a fresh orange in your grocery store. So this is why you're never going to help your cold that much taking orange juice, whether it's fresh squeezed or whatever. You know, the dosage that your white cells require is it requires over 3 grams to significantly affect the deficiency of vitamin C in the white cells. So you can't do it. Eating oranges, grapefruit, natural remedies. And this is where the activity occurs, is in the higher dosages. And Linus Pauling, he had 3 different books out. Vitamin C in the Common Cold, which you can probably find these days, but it's difficult. Vitamin C in Cancer, and of course, Nobel Prize winner. They did everything they could to discredit the work that Linus Pauling did with vitamin C. And I saw him speak when he was 93 years old. He was up speaking to a group of 500 doctors, and he stood up there and he says, I've taken 12 grams of vitamin C every day of my adult life, and it hasn't hurt me at all. So I'm going to stick with Linus Pauling's suggestion.
Okay. So one more question with this. So the right C also contains the ingredient ribopurine. Can you talk about its significance?
Okay, the ribopurine is a bit of a trade name for the they take ascorbic acid and they convert it to sodium ascorbate, and then they take something similar to molasses and they react it or ferment it together. So what that does is it binds the sodium ascorbate into a cofactor, and the cofactor keeps it in your system longer because it takes the body longer to break down this cofactor associated with the vitamin C and excrete it. So that's the reason that it stays in the body longer. And they did the same thing with ester C in the original patent. However, the current ester C product is no longer, from what I hear, reacted and made according to the original patent, which makes it less effective than the original ester C on the market. Good product, but not as good as it originally was when they were making it the original way.
Okay, so let's start shifting gears and talk about application and vitamin C applications. I know you've discussed, just as throughout you were talking, different areas of application. Let's focus right in. So the first area of application in allergies, asthma, and inflammation.
Okay, so the first area that vitamin C works the best with is, of course, taken with a citrus bioflavonoid. And, of course, we all know what quercetin is. It's one of those. So this is why, you know, taken with a little bit of orange juice, or a little bit of grapefruit juice, you know, improves its activity because you're getting the citrus bioflavonoid along with this. Now, you can create a situation where a person that's on salbutamol and some of the steroid anti-asthmatic drugs, you can reduce those dosages down to pretty well as needed, PRN, by taking 2 to 4 grams of vitamin C a day. You know, remember, in divided doses. Start off with 2 grams 3 times a day, and then they will be finding that they will reach to the puffer much less. And probably within 2 weeks, they will be carrying the puffer around in their pocket, almost not using it, because the vitamin C is going to cover the reactivity of the allergic situation. And of course, vitamin C also reduces stress. It affects the cortisol levels very positively. And also, vitamin C, there's a lot of studies done at high altitudes in cold weather. So vitamin C is the hot weather vitamin, and it's the cold weather vitamin. Well, why is it the hot weather vitamin? Because guess what happens? Your body gets rid of vitamin C in your sweat. You know, so if you're in the tropics, the more vitamin C you're taking, the better you are. And this is the same way in cold weather. When you're skiing, vitamin C greatly enhances your resistance and adaptation to cold. And I'm not sure the mechanisms on that one, but they've done a lot of high altitude research with mountain climbers that have been taking, you know, anywhere from 2 to 10 grams of vitamin C a day, and their ability to adapt to the cold and resist frostbite is much better. So if somebody comes into your office and they've just been bitten, say, by a bee, and so you're wondering what to do. Okay, do we get the EpiPen out? Well, you don't happen to have an EpiPen in your desk, so if you have some vitamin C, some ascorbic acid, and you can find some baking soda, you put the two together, ascorbic acid and baking soda, so you've got an acidic situation and you've got a sodium bicarbonate situation, which as soon as you put water with it, it starts to fizz up. Now, when you change the acidic state of an anaphylactic reaction, you move it to the alkaline state, the reaction, the anaphylaxis, immediately subsides. You know, and I've seen this. I've had a lady come into my pharmacy. She's been bitten by a bee. She doesn't want to go to emergency. Do we have anything I could give her? No, I didn't have an EpiPen, so I ran over to the counter and I got my buffered vitamin C. I put a tablespoon into a glass of water. I said, drink this down and sit down. Within 10 minutes, I saw the redness and swelling and reactivity of this lady go down to my amazement. I mean, when I first saw this, I thought, oh my God, this really works. It was a buffered vitamin C that we just happened to have on the shelf, and so this is really a good emergency situation product if you have something like this.
Okay, so then let's move on and talk about applications with cold and flu.
Okay, well, remember the flu and cold. If you take aspirin, of course, I'm not a big fan of aspirin, but it does cause the uptake of the vitamin C to go into the white cells. And the white cells are the guys that are doing the work on pneumonia or the viruses. Give tablespoon dosages of this product. Give it in your orange juice, and do it every 2 to 4 hours. A tablespoon every 2 to 4 hours. Now, if they have pneumonia and they're on an antibiotic, don't worry about it. That means they're going to be on the antibiotic for 5 days, and at the end of that time, the difference in this patient's recovery is just amazing. Just amazing. But you really have to be aggressive on the vitamin C dosage. You can't mouse around with 2 or 3 grams a day with pneumonia. So it enhances the activity of the antibiotic dramatically.
And when you're talking about this dosage, again, you're not talking about ascorbic acid. You're talking about sodium ascorbate.
That's correct. If you're trying to give 50 grams of straight ascorbic acid, you're going to give the person a pretty sour stomach. You can use the straight ascorbic acid at this dosages, but you know, you must neutralize the acidity with your sodium and or potassium bicarbonate. Usually I recommend a 1-to-1, 2-to-1 sodium potassium bicarbonate with the ascorbic acid if you don't have the right seed. So that works. And you can give dosages like that. And you give it with your orange juice, and you know, this works just as well, quite honestly, if you don't have this particular product available. And you can get the ascorbic acid powder in most health food stores. And then if you're going to give this along with some quercetin, you know, then the results with pneumonia are quite dramatic. And the doctor's going to say, wow, you know, I've never seen my patient on antibiotics with pneumonia recover so fast. But aggressive dosage, absolutely necessary.
Okay, so now let's talk about vitamin C applications with diabetic complications.
Okay, well, the first place that we see the problem with diabetes, of course, is the back of the eyes. You get the damage of the small vessels in the back of the eyes. You get the damage in the small vessels in the feet and hands. You're getting diabetic neuropathy. And, of course, vitamin C levels, high vitamin C levels for the diabetic will absolutely prevent diabetic complications such as diabetic retinopathy. They will prevent the complications with the feet where they get terrible pain in the nerve pain in the feet because it doesn't really control blood sugar levels, but it controls the reactivity. In other words, when the blood sugar level is high and you have no vitamin C, it's damaging to the arteries and the vascular system. And the vitamin C protects this damage in the vascular system due to the high levels of blood sugar. But per se, vitamin C does not control blood sugar. But it prevents all the complications thereof of high blood sugar. So again, for the diabetic, 6 to 8 grams a day, every day for the rest of their life, and you'll have a diabetic that never gets all the nasty side effects of diabetes, whether the blood sugar is good or whether the blood sugar is under control or not under control. So this is a really very nice, cheap tool for the diabetic. Really, really good. You can take it with all of the other supplements and all of the other drugs that they're taking, but it's going to prevent that deterioration. Number one, going blind. That's the first big one. And then the pain in the feet. And then the circulation. So with diabetic ulcers, of course, this results in complications of the vascular system not being able to feed and heal up the ulcers. So once you give vitamin C to a client with diabetic ulcers, amazing things happen. These things heal up where they've never been able to heal up before. And I think Heather has just had a miraculous situation with her mother where they were going to amputate one of her feet. And we put her on aggressive vitamin C, we put her on hyperbaric oxygen, and she still has her foot. Mm-hmm. Her recovery is complete. I mean, this was amazing, amazing.
Yeah, absolutely amazing. And my mom, she used the right C, and every morning she would put it in her smoothie. So she'd put a teaspoon in, so it was approximately 4 grams every morning in her morning smoothie. And then she would also take it at least one other time during the day. Sometimes she'd add some extra ester C, but it was the right C, getting it in that high dose, especially in the morning when she was doing the hyperbaric oxygen, that really helped that wound heal up quickly for her. She's a lifelong believer of vitamin C. So
I think this probably amazed most of the doctors that were treating your mom, that this foot would ever heal up. I mean, she could show you a picture of it, but it'd ruin your dinner.
Yeah, it was a pretty phenomenal healing experience. Okay, so let's move on to vitamin C applications in cardiovascular and constipation applications.
Okay, so generally for stroke, complications of stroke, they recommend baby aspirin. Now, there's nothing wrong with taking a little vitamin C along with the baby aspirin. I'm not going to say don't take the baby aspirin. However, we have a product now that's been shown to be as effective as aspirin for prevention of stroke, and that's tocotrienols. But that's a topic for another whole seminar. But the vitamin C taken along with, well, it's not a blood thinner. It works with the aspirin, and it helps cardiovascular complications and certainly making them less risk to have a stroke. And the other remedy we'll throw in, again, which is a topic for another seminar, which is the salt tonic, which is a Chinese herbal remedy. So that is our prevent stroke complication kit. So constipation, vitamin C, too much of it, draws water into the bowel. It's a real simple process. And so when the bowel gets a little bit loose, you just simply lower the dose of vitamin C. The detoxification of the bowel is the main benefit, because when the bowel has been clogged up for 3 or 4 or 5 days, you know, it's a nasty business. And when the vitamin C works as explosively as it does by pulling water into the bowel and creating a little bit of what you could say gas, you know, then the bowel is helped to heal up with the high doses of vitamin C. So, again, 2 to 4 grams every 2 to 4 hours until you get the desired effect. She's got twice a day, but if you give 4 grams, which would be a teaspoon, you give it every 2 hours until you get results. And results you will get. It works best when you're giving it the ascorbic acid, sodium bicarbonate, as opposed to just giving the right C, because it's good to have a little bit of gas in the bowel to help loosen it up.
Okay, so now let's move on to vitamin C applications in wound healing and pre- and post-operative and anesthesia recovery.
Well, post-operative, this is amazing because you know, I've had clients come in and they've had an operation, whatever it was, 2 days later, and they're still groggy from the anesthetics. And so I say, well, right away, you know, take some vitamin C. Well, you know, they'll snap out of that anesthetic grogginess, you know, in a matter of 3 or 4 hours. And I've had some patients, they say, well, I have to have another operation in 2 or 3 weeks. You know, and I really don't want to do it because I feel so terrible after the anesthetic. So you give them post-op and pre-op 5 grams of vitamin C. Now, the physicians often would recommend that you don't do that because in some cases they have to give more anesthetic to get them under when they go loaded up with the vitamin C. So if they don't take it before, and you have somebody come in the hospital, put this kind of a dosage in a little bit of orange juice and give it to them right away, their recovery from the anesthesia will be just amazing, because the liver uses it to detoxify the anesthetic. So that's one of the effects in the body with the liver. And I have, again, another sort of personal story. I was in Fiji once and I picked up hepatitis in the water, came home to Vancouver, and my liver enzymes were right off the chart. The doctor said, wow, you know, the water really must have been bad there. I don't know what we're going to do. I don't think I can get the liver enzymes down. And so he gave me 50 grams of vitamin C intravenously, daily, for 3 days, and on the 4th day, my liver enzymes were down to normal. He says, wow. So the liver really uses this stuff to clean up bad situations. And of course, in that situation, the best way is to give it intravenously.
When in a post-operative situation for mothers, new mothers who've had a cesarean section and are breastfeeding, can they take this volume of vitamin C, or should they be taking it for recovery of surgery? What should they be doing?
They don't need to take the dosages that we're talking about if they're breastfeeding, and I would not encourage that. Now, there is some study that says there's a problem giving a baby, an infant, vitamin C, and they are going to get some of it through the breast milk. So we don't want to load mom up with 10 grams of vitamin C when she's breastfeeding. You know, I would say 1 or 2 grams at the most for a breastfeeding mother is plenty adequate, and it's going to give her enough vitamin C to help heal up if she's had a cesarean or something like that.
Okay, excellent. I think we have here, okay, so one more application, and this is talking more about vitamin C and malignancy and cancer. Can you talk about vitamin C's role in that case? And then you mentioned about IV vitamin C, so in scenarios of IV vitamin C versus oral vitamin C, or maybe in combination.
Well, vitamin C IV, of course, is sodium ascorbate. That's the baby that they use because there's no irritation for the veins, and the pH can be monitored and adjusted so that there's no irritation for the vascular system. And you can give much higher doses, and of course, the dose that they have found to be useful in malignancies is in excess of 50 grams a day. And usually they put this into some kind of indwelling shunt. And I've seen cancer doctors send the patient home with an indwelling shunt, and they give their own 50 grams of vitamin C a day. You know, there's a lot of studies that are done on this, but depending on the malignancy, you know, this is useful. I'm not going to say it's curative, but it's useful.
Okay, excellent. What I've understood about using the right C, because it's sodium ascorbate, is that patients can go to their practitioner that's able to do IV vitamin C and have their dosage, and then use the sodium ascorbate or the right C orally in between treatments to help keep that blood plasma level up.
Absolutely. You know, they could certainly, you know, if they get an IV 3 times a week, then, you know, they will take the sodium ascorbate or the right C at bowel tolerance level, wherever that is, until they get their next IV.
Okay, excellent. Okay, so then we have this off-label dosing recommendation chart. And you can see some of these values here in grams are very high. So Harlan, can you talk on this a little bit?
Well, you can see some of these dosages, you know, between rheumatoid arthritis, 15 to 100 grams. Well, it's going to be challenging, but you can get 5 grams 3 times a day with rheumatoid arthritis, and it has an anti-inflammatory healing effect. So burns and injuries, of course, the same thing. My daughter broke her arm, and within 3 weeks, you know, we had her on as much vitamin C as she could take. Within 3 weeks, she was out of cast, and the doctor looked at her x-ray and said, "Wow, kid, you're a fast healer." Well, you know, she got a lot of vitamin C in her orange juice. So medical science and the research studies, they don't agree with these kind of dosages. But my way of looking at it is you're not going to hurt anybody with these kind of dosages. You're not going to break the bank with these kind of dosages. And the benefits are all there. And you'll know when you get the right dosage because the body gets rid of it. And so, you know, I've used aggressive dosages of ascorbic acid all my professional career. And if I had to do it over again, I would have started earlier. So I think more in this situation is better. The physicians, I've been giving lectures to pharmacists, and there's quite a lot of misinformation out there. And when I recommended that they take 1 gram 2 or 3 times a day, I've had a half a room of pharmacists get up and walk out because medical science is just not there yet. But the benefits are. So the choice is up to you. Your patients will thank you for it, and so will their bank book.
Excellent. So the first question that came up is about vitamin C and quercetin. Do they always need to be given together, or is there instances where they can be done separately or together?
They are better taken together. Remember, quercetin is a citrus bioflavonoid cofactor, and the uptake and the absorption and retention of vitamin C is enhanced by taking citrus bioflavonoids and specifically quercetin. So you're going to get a better antihistamine effect taking them together. Remember, quercetin is going to stabilize the mast cell, and the mast cell, of course, is releasing the histamine. And when there's not much histamine in the mast cell to release, if they do have an allergic reaction, it works very much like a very strong antihistamine, but there's no what we could call antihistamine tolerance where you have to give more and more and more and more. For the vitamin C level, you're going to get an optimum level at a certain dose, and you don't have to increase that dose like you do after you've been giving somebody an antihistamine.
Okay. So when you're talking, just to clarify, when you're talking, you know when you've hit the dose. So does that mean with vitamin C, you know you've hit the dose when you hit bowel tolerance, and that's when the body's starting to get rid of it?
That's right, yes.
Okay.
As soon as the acidity changes in the bowel and the osmotic pressure across the bowel changes, water comes into the bowel and boom, you get a laxative effect. So it's a really very harmless reaction, but the body's, very careful at not getting too much of a certain thing in a certain part.
Okay. And so if you hit bowel tolerance, would you recommend then that you step back a little bit? So let's say you've hit bowel tolerance at 10 or 15 grams, let's say 15 grams. Would you then back off to 14 grams for that client?
I would back off to, say, if you were given 15 grams, and you got just mild runny bowels, then you could drop back to 12 grams. But obviously, I would go back to 10 grams and then slowly inch your way back up there until you get the level of bowel activity that is tolerable, that isn't annoying. But generally, I drop back about a third in the dose, and then inch back up there to the level that is optimal.
Okay. And I have one clarifying question regarding pneumonia. So with pneumonia, you talked about using 1 teaspoon every 2 to 4 hours until you hit the phlegm stage. Once you've hit the phlegm stage, what is then the recommended dosage until they heal? Okay,
so pneumonia, I'm going to correct you there. It's not 1 teaspoon, it's 1 tablespoon.
Oh, sorry, yes, sorry, 1 tablespoon.
Okay, so that's 15 grams. And generally, I give as much of the citrus bioflavonoids in other supplements along with this, and you'll see the phlegm start to not be so thick, but at what dosage this is, depending on how long they've had pneumonia, I generally start with the normal acetylcysteine. I give it along with this, 500 milligrams 3 times a day, normal acetylcysteine, and giving your vitamin C dose to bowel tolerance along with your quercetin or your citrus bioflavonoids. And you keep this up for certainly the course of the antibiotic and at least 2 or 3 days after they finish the antibiotic. So in some cases, they'll be on the antibiotic 10 days. So this is pretty aggressive therapy for 10 days with the vitamin C, but the recovery is amazing, just amazing.
Excellent. Okay. So now we've had a few questions come in. So vitamin C and Candida. How is this beneficial and what's the relationship?
Oh, that's a great question. Candida is very susceptible to pH in the body. So what we don't want to do is create an acidic condition for the Candida. So you must use something like the sodium or the calcium ascorbate so we don't create an acidic condition for the Candida. The alkaline condition is the best way in the bowel to treat the Candida. So that's the main thing to consider is you don't want to use ascorbic acid, you don't want to use emergency that's going to create an acidic condition that patronizes the Candida, so to speak. You want an alkaline condition in the bowel.
Okay, and so next question, can vitamin C decrease alkaline phosphatase levels?
Yes, it can. I just specifically can't tell you how much. I'd have to Google it and see just how much it does, but it definitely affects alkaline phosphatase.
And what would you do about it?
What would I do about the decrease in AK? Well, that has to be a little more specific question, I guess. I don't know how to answer that one.
Okay, so we'll research it and look it up.
Yeah. We can get back to the person that sent in the question, sent more specific details, and I can give you all the information you need.
Excellent. Okay, and then quercetin. Which product or brand of quercetin do you like best?
Well, there's a variety of quercetin products on the market, and I really don't have any preference. If it's pure, refined quercetin, I don't really know which products are the best. I've never really, I wouldn't say quercetin's quercetin, they're all the same, but I don't know which is the better one. But again, I can get back to the person that sent in the question and let you know in a day or so. I can easily do that research. I'm happy to do that.
Okay, excellent. Harlan, one last question, and this has to do with iron and vitamin C and their relationship.
Ah, wonderful question. Glad you came up with this. It's very interesting. 25 or 30 years ago, the people in Africa decided to help the poor Africans because they didn't have enough iron. And so they brought iron pills to the African tribesmen, and they gave it to them, and of course the diet of the tribesmen was extremely low in vitamin C. As a matter of fact, the diet of the tribesmen was mainly meat. And so they gave iron, and then what happened in the next few weeks is that they started dying of complications that they'd never ever seen before. And they couldn't figure it out. Well, we raised their iron. Why are they all dying of diseases and immune system problems that we've never seen? Because these people virtually had no vitamin C in their system, and when they gave iron, iron acts like a free radical, and it started to destroy the immune system. So when you take vitamin C and iron, of course, it helps the uptake of iron, and it protects the body from too much iron. So really, anybody that's taking iron should, at the time you're taking the iron, take 1 or 2 grams along with the dosage. Then, number one, you're getting an increase in uptake of iron, and you're getting protection from free radical damage of too much iron.
Okay. And so with that, we don't have any other questions. Is there any additional clinical pearls you'd like to close our webinar out with tonight?
Well, remember, melatonin is your best sleep aid. And krill oil is definitely something to look at that works a little bit better, particularly for the brain, than fish oil. And the reason that krill oil is the phospholipids make it more absorbable. The phospholipids are some of the things that the brain uses. So if you're a big fan of fish oils, then I'd say give krill oil a try and see what the difference is in your clients. The difference in price is not that much, but I think you'll find the difference in results is significant.
Excellent. Thank you very much, Harlan. Thank you for sharing your 40 years of visionary pharmacist clinical pearls, specifically about vitamin C. This is a long time standing product with huge benefit, but not necessarily talked about so much in the here and now in our natural health world. So remembering something that's very simple, inexpensive, has huge broad application, and a reminder of this and how easy it is to use has been really excellent.
Well, it's certainly the forgotten nutrient with huge broad applications at a very low cost and virtually no toxicity. So I don't know why we're not using more of it.
So we have a few more questions, Harlan, before we go. Complications with vitamin C, high-dose vitamin C, and stroke, or bleeding specifically.
Well, let's see. Complications with bleeding and stroke. Generally with stroke, high dosage of vitamin C, I think you have to certainly monitor the prothrombin time, because it will affect prothrombin time. Higher dosages, say if they're on warfarin or something like that, they need to be taking regular prothrombin time tests when you're starting to give them reasonable dosages of vitamin C, for sure. So we don't want them to start bleeding more than they should. And if they're only getting their pro times every week, you know, and you dose them up with vitamin C, be careful.
Okay, perfect. So monitor that. The right C, is it good for people of all ages, stages, and other medications? The right C used for all people of all ages.
You know, I don't know the situation when the right C is going to be interactive with medications. I haven't run into that. Specifically, if we do a search, you know, on our interaction chart, there certainly are interactions with specifically vitamin C and some drugs. I don't have that whole file in my head. If there's specific questions in that, you know, you can email me. We can tell you exactly, specifically, does high doses of vitamin C or right C interfere with the drugs? I'd have to look that up. We do that all the time at Finlandia, so feel free to call the pharmacist at Finlandia and throw that question at them, because we get it all the time. But I don't have specifically the answer to.
Are high dosages of vitamin C harmful to the liver?
I would say categorically no. As a matter of fact, high doses of vitamin C are very beneficial for the liver. And so we're even somebody with cirrhosis of the liver is the organ that detoxifies everything in the body, no matter what it is. And of course, the vitamin C is the mechanism that helps the liver detoxify. So, you know, in my particular situation, 50 grams of vitamin C intravenously with severe hepatitis, it was a miracle. And so I've not heard of it being harmful to the liver under any circumstances. And can you take NAC with the right C? Absolutely. the dosage for NAC to reduce phlegm is 500 milligrams 3 times a day. Take that right along with your 2 grams 3 times a day, and you'll find that whether it's phlegm in the throat, phlegm in the sinuses, phlegm in the lungs, they work very well together.
Okay, excellent. In pneumonia, would you be giving probiotics in addition to vitamin C while they're on antibiotics?
Good question. Now, most good antibiotics kill most probiotics. So I generally say, when you're in the last days of taking your antibiotics, say you've got a 10-day supply of antibiotic on day 8, start taking your probiotics and take it for 10 days after you've stopped taking your antibiotics, because in most cases your antibiotics are going to kill the bacteria that you're feeding it with your probiotics. There's very few probiotics that are antibiotic resistant.
Okay, excellent. That's good advice. So take your probiotics after antibiotics. Maybe during as well, but the after is the important part. Okay, so now that we have answered all the questions, for all of you, thank you so much for joining us tonight and learning all about clinical pearls and very specifically about vitamin C. Take care, everyone.